Hi there and welcome back. So we started endocrine system right from the top with pineal gland, pituitary gland, hypothalamus, thyroid and parathyroid, pancreas, adrenal glands, and now we are almost ending with the gonads or the ovaries or the testicle. So working with the hypothalamus and pituitary gland, each and every gland would release certain hormones, and same thing happens with the gonads. So homeostasis is the key in the endocrine system, and ovaries, as we know, release certain hormones, estrogen, progesterone, necessary for the sex characteristics, breast development, progesterone responsible for preparing the uterus in pregnancy, so on and so forth. Testicles for the testosterone. I'm not going to go into these details because these are so common that we all understand. So, the gonad covers the reproductive sex, testes and ovaries, and the homeostasis is important. Hypo or hyper, it leads to hypergonadism or hypogonadism, right? It can affect male, it can affect female. So when there is a deficiency in the ovary or testicle function, is labeled as hypogonadism. And there could be several possible origins, including absence of sexual development in an individual, or feminine or masculine sterility. This disorder can result from a congenital anomaly. There is a name given, Turner syndrome. If you are curious, you can look it up. And there are some data that suggests that it can also happen from consuming the vegetables that were grown in soil that is rich in cadmium. So, hypogonadism in women, it can be primary, it could be central, it could be menopause. And now you know by now that when we say primary, it happens locally, right there. Centrally is something that doesn't go right with hypothalamus or pituitary gland, right? And of course, there could be additional unique situations, as is the case here with the menopause. Now, the primary could be characterized by poor ovary circulation. FSH, LH are, simply speaking, the hormones produced. They are produced by the hypothalamus and pituitary gland, but ovaries produce either little or no estrogen. So there could be variety of combinations depending upon whether it's primary or secondary or central. And I just explained that, so I'm not going to repeat that. And when we talk about the men, it can be deficiency in testicular function and sperm productions and so on and so forth. And typical pathology is evoked in pubescent males around the age of 14 years. Delayed puberty is observed with little to no hair growth, increased breast volume and small sized testes. Hypogonadism can cause loss of libido, impotence, infertility. As far as treatment goes, prescription of estrogen or testosterone, surgery and or radiotherapy. Okay. Hypergonadism, other way around. Instead of hypo, this is hyper. So there is abnormal elevation. It could be evoked by several causes, maybe genetic, maybe autoimmune, maybe some sort of benign or malignant conditions, tumors. Precocious puberty, increased hair growth, increase in libido goes without saying. And the symptoms are more or less same in the men and women. These are the things all self-explanatory. And hormone replacement therapy is the principal treatment. Medical observation is necessary because so that you can have the right amount of dosage. Okay, and in 45% of the cases, data suggests that it can be optimized, and there comes the experience and expertise of endocrinologist. Before we conclude this presentation series, I have few things to share with you. So, we have reviewed various systems from nervous system to immune system to endocrine system. Now there is a lot of overlap. So it's not necessary that we can say that what we reviewed are the only endocrine system or the organs that play a role in our body. Because we can have brain, liver, stomach, kidney, they all are hormone secreting structures. So where do we draw the line? Medical literature is loud and clear. So what we reviewed are the traditional ways of labeling those pituitary tumor, hypothalamus, thyroid, parathyroid, adrenal, pancreas, ovaries or testicles as traditional way of saying that they are the major contributors when it comes to endocrine system. But we do have many other contributors out there secreting the hormones. The key to me and for all of us is how they interact with each other. The homeostasis is at the core of the endocrine system. The Wi-Fi, the positive negative feedback. That's awesome that God has created in our body. And we can relate that to us because we have a triangle of underwriter, field partner and customers. When I do any of such presentation series, what do? I go through variety of typical textbooks to begin with, from elementary to advanced version, and try to see how I can simplify to preserve the interest of customers who may not have the medical background and our field partners because they sell other lines of business, not only life insurance, so they may not have the appetite for the medical. So I start with simple to advanced version of textbooks. There are variety of literatures out there in the form of textbooks. Then I go through variety of websites. Then I get the literature, variety of publication from the American College that provides to the charter life underwriters throughout the year. Plus we have Academy of Life Underwriting that provides on the risk article from variety of experts. Plus we have NAIC, LOMA, LIMRA, Academy of Life Underwriting. So various institutions out there, from time to time they release variety of publications. I try to connect those dots. Plus we have a laundry list of websites that I try to search to figure out how it makes sense to our customers and field partners. Let me give one example here. When we say about all these references, one critical element is RMD, refer to medical director. When we say doctor, what comes to our mind in last 2 years and even beyond that, traditional mindset is about clinical practice, that doctors are out there in the hospital, in the emergency room, they are doing the routine checkups, they are doing the critical surgeries, so on and so forth, right? Kudos to all doctors, they are the hope of humanity. They have been extremely instrumental in fighting against the current situation in the last 2 years, and hats off to all of them. I salute them. Beyond that, there are many out of those who are out there, there are many, they do clinic. Besides all this, what they do is, there is there is a field called insurance medicine. So in insurance medicine, what happens, there are many doctors, either they have retired or they have that passion to serve the customers and to serve the insurance needs. So as a consultant or as a full-time, they serve the life insurance industry. And there are complex cases where their expertise matters. And they all are looking at the same records, and there are thousands of companies out there. Some company would offer standard, some would offer preferred, some would offer table 2 plus 50, so on and so forth. And why is that? Because every company's claims experience, their mortality research data are unique. And with accelerated underwriting, there are lots of tools out there that we try to price based on present evidence. The difference between insurance medicine and clinical practice that we normally hear, let me give you one example. Let's assume that we have a wedding in our family. What we do, we hire a professional photographer or professional photographic service. What they do, they take the pictures, they take the video recording of the wedding ceremony, right? When they take the picture is one thing, when they take the video is another thing. Clinical practice is like taking a video. The doctors have the freedom to tell the patient that you come and see us after 6 months. Your blood sugar is somewhat elevated or your PSA is somewhat elevated. Let's have a wait and watch approach. Or your liver enzymes are somewhat elevated. Let's have a wait and watch approach. Watch your alcohol intake, so on and so forth. Whereas in insurance medicine, we don't have that freedom. And there, the expertise of MDs matters because we have to price based on what we have in front of us. Okay? So that's the difference between insurance medicine and the clinical practice. I just wanted to conclude this endocrine system by recognizing that we have talented years of experience of MDs out in the insurance industry as well, working with us to guide us in our daily routine. So I salute them, and that's all I have for now. I hope you are all vaccinated, have taken your booster shots, exercise common sense and due diligence, and stay safe out there. We'll see you soon again. Take care. Bye-bye.